Hey guys, it's Dr. Jake at Pacific Psych Centers in San Diego. It's July 17th, Saturday, 2021. So this is the third video that I've done. I don't know how good they are. I don't know how useful they are, but I'm going to keep doing them and hopefully they'll get better over time. But today I'm going to take a few minutes and talk a little bit about the specifics about how we use ketamine in our practice. So we do a few different things. We do IV ketamine infusions. We do intramuscular ketamine injections. They're very similar. I've talked about those in another video. I'm not going to go into that. One other thing that we do at our clinic, which is relatively new, is ketamine assisted psychotherapy. So the difference between that and what we've always done in the past um, is that these are a little bit extended. These are have a little more support. They're still going to be done by a physician, myself or my wife, Dr. Jessica, but there's going to be an additional support person, and that is going to be one of our MFTs. So it'll be probably Alex or Aya, potentially Christina. She's going to be taking some time off in the next couple months, but the way that works is it's going to be a 2.5 hour treatment. So there's going to be some time built into the front of those treatments, and there's going to be some time built into the back to do a little bit more psychological work, more support, more intention setting. We're going to really get, some people feel like they want to get more out of the treatments by bringing in a therapist. And I've done that in the past. And even in the beginning, we did that model. In the very first couple years, it was a ketamine assisted psychotherapy, even though that term wasn't coined at that time. Um, the way that we started it was I would do each treatment and I would spend 2 or 3 hours with each patient because really um, we were trying to be safe, allow for extra time. We didn't know how we could be more efficient. So over time, we've developed some efficiencies that have that have allowed us to lower the price, to increase the access for patients because ketamine is not covered by insurances for the most part. So all the cost is put on the patient. So my goal up to this point has been to make it as economically and practically possible as we can, which basically means we do two at a time. So we offset two treatment rooms, which allows us to keep the price point down. But some people feel like they get more out of a longer duration, more supported treatment. So that's what we're doing. We're offering a ketamine assisted psychotherapy version of our treatments. Like I said, they're about 2.5, 3 hours. They're still going to be done by the physicians, myself and my wife, and there's just going to be more support. So um, the way that people do this is going to be different for every individual. Some people are going to want to do these all the time that they do ketamine. Some people may want to do a ketamine assisted psychotherapy session every once in a while and do the more inexpensive versions that they're used to for the bulk of their treatment. But they may have something particular that they want to work on with the help of ketamine and with the help of a psychotherapist. Um, if we want to do therapy around the days of treatment, that can be done too. It'll just be done on a different day and it'll be at the rates that we charge for psychotherapy. Um, and you can call the office to figure out, to find out what those rates are, but they're very um, reasonable compared to the rest of everybody doing this. Um, it's still going to be, it's going to be a really good option for some people. Some people prefer not to do that and they want to do what they've always known at our clinic and to do the treatment where they're essentially, once the treatment is started, they're left to themselves or to somebody that they bring in the clinic. And people are welcome to, bring whoever they want to bring into the clinic if they feel that's going to be helpful for them for support. One other option that we're going to be doing is to do the same duration treatment, but I'm going to have either one of the marriage and family therapists sit in with the patient to just provide some general support throughout the treatment. And this may be done, maybe the first treatment or two where there's a lot of anxiety and a lot of nerves that are brought into those treatments. So it may be somebody that can't bring somebody with them and they just need somebody to sit with them and provide just some supportive words, some grounding, maybe go through some breathing exercises in the peak of ketamine effect. And a lot of times people are going to do this for treatment one or treatment two and then realize that they can handle it without it. It will be a small fee associated with it, but it's our way of being able to cater to each individual. Some people want a very minimalistic presence from the providers to do their treatment on their own. Some people want a little more support. So we're able to kind of flex and provide both for all people, for all the patients that come to the clinic. Um, we do things our own way. It may or may not be similar to other clinics in the country that are doing this, but I'm pretty sure it's something in the ballpark of what most clinics are doing. There's outliers on either direction, either very conservative or very aggressive. I think we kind of sit in the middle of that. We try to practice some more evidence-based, but we have a lot of anecdotal experience that we put on top of what's been done in the academic settings with all the clinical trials. So I think we have a really good model. I'm really excited to really embrace the ketamine assisted psychotherapy modality, and we'll see how it goes. And for people that have questions about what we're doing about the ketamine assisted psychotherapy, or if they want to know more about what our original, or what, I don't know what the term to call what we normally do, but without ketamine assisted psychotherapy. Um, we'll talk about that in detail at the consultation, and we can get people set up for whatever they feel like is best for them. And along the way, we'll obviously adjust the treatment. Each ketamine treatment will have a portion done with me or my wife, to kind of alter the treatment plan on a treatment to treatment basis. But I think it'll be a good addition to the clinic, and it's really kind of setting the stage for what we're going to do with psychedelics, such as MDMA and psilocybin, when and if they become FDA approved, because those are going to be the only way that we're going to offer those is with a psychedelic assisted model. There will not be anybody sitting alone for that duration of time during a psychedelic treatment. You know, so that's all. More details to come on that. That's still a year or two out. I'm sure that probably in the future I'm going to put out many videos on psychedelics, as I'm sure I mentioned on the previous videos that I'm about halfway through the CIIS psychedelic psychotherapy program, and it's been great. And it's just got me nothing but excited about those modalities coming to the clinic, and we will bring those to the clinic as soon as we possibly can. But we just got to wait until it's basically legal for us to do that. And there's no guarantees that's going to happen, but it looks really good. So, anyways, that's how we're doing ketamine right now. Like I also said in the consultations, I'll be able to answer all those questions that you have about what's right for me. Like, for example, should I do ketamine assisted psychotherapy? How many infusions am I supposed to do? What kind of dosing are you going to do? Should I do IM or should I do IV? Um, so, anyways, if you guys have questions or comments or suggestions for future videos, just leave them in the comments. We're just getting this thing started, and I'm really learning the basics behind posting these videos. I know they're not flashy, they're not produced, it's just me talking. It may be super boring, but hopefully they'll get better and better over time, and hopefully they'll be really useful to people contemplating these types of treatments in the future. So, anyways, the last thing I'm going to say for those people that are current patients of the clinic, I'm going to be out of town next week, so we won't be able to do any treatments from Monday to Friday of that last week in July. But we'll be business as usual on Monday and all the way up until I leave on Friday. So, anyways, take care of yourselves, and I'll see you next time.